We would like to welcome everyone to the fourth session of our Impact of Dental Health on Preventing Future Medical Complications. Now, our series is sponsored by Equoral and Philips, and tonight's session is sponsored by the Oral Cancer Foundation. So we'd like to thank those sponsors for bringing these sessions to you. Tonight, our guest is Dr. Guy Mittal, and Dr. Mittal is the Chief of Integrated Care and Psychiatric Services with Forge Health. His approach to care, recognizing the importance of connection between physical and mental health, is transformative for the healthcare industry and one that can lead to better medical outcomes and overall well-being for so many people. And we're really excited to hear about it.
Yeah, and again, we're thrilled to have Dr. Mittal too. I said it wrong again, Dr. Mittal. I know. I love you though. We are thrilled to have Guy with us, and I'm going to say Dr. Guy because I'm just going to butcher his last name, I've decided. But Dr. Guy with us to talk about the mental health implications of poor oral health, understanding the connection. Of course, that's near and dear to my heart because I'm a mental health provider and have worked in the field for many, many, many moons. But before we get started, there are 3 housekeeping items that I want to make sure that we address. So first, everyone has been practicing putting where you're from in the chat. Make sure under the to button that it says everyone. Otherwise, it will just be JJ, myself, and Dr. Guy who can see all of your comments. And we want everyone to be able to see each other's comments to inspire. Any questions that you would like to ask, put them in the chat. And then if we run out of time for some reason, I will get with Dr. Guy and we will get them back to you in the next day. Also, we are excited to offer continuing education credits. I know some of you guys have been with us since the beginning, and JJ is putting the link for the CEs in there. You can also find them on our website, confessionsofareluctantcaregiver.com, under training, and it'll say continuing education. All the instructions for dental professionals, RNs, social workers, and speech and language therapists, all your instructions are in there. For the folks who are dental professionals, at the end of the second bullet, it will say link, and that is where you find the code for your continuing education to put in for the survey. So just as a heads up, I want to make sure that we're saying that. And of course, tomorrow we will send out a recording of this email, probably around lunchtime. Got to upload it into YouTube. We will have the survey, and we will have, of course, all of our fantastic sponsors and links to our sponsors and partners and series partners and all that great stuff. And we thank Equoral for giving a discount code. So make sure you take a look at that. They're giving 30% off on for folks to be able to try it. So without further ado, I think we have done all of our housekeeping duties. Dr. Guy, are you ready?
I'm ready.
Oh, I love it. All right, well, let's get started.
I'm not normally called Dr. Guy. I kind of like it.
Oh, well, thank you. It's better than
that makes you cool.
Yeah, it does make you kind of cool. All right, so let's just jump right in. So let's talk about, really, why are we talking about dry mouth and mental health?
Well, I'll tell you, it's part of a larger conversation. And the conversation is, now let me give you a little bit about my background. My background is I work with people with severe medical conditions, particularly people dealing with cancer or other complex and potentially life-limiting illnesses. Mm-hmm. But as you know, people recover to whatever degree they recover, or they live with the illness as a chronic illness. And the reason it's a larger conversation is the notion of how do I live with symptoms that I wasn't expecting? How do I live with symptoms that are bothersome, reduce my functionality, but don't keep me from living my day-to-day life? How do I live with these new symptoms that I wasn't expecting? Like, nobody told me it would be like this. What I mean by that is people are told, for sure, for example, if you have radiation treatment for a head and neck cancer, one of the complications for some people is you have dry mouth. Like, you can no longer produce saliva or greatly limited amounts. And when you're told that, you kind of think, okay, no big deal. I have cancer. I don't want to die. And you don't give it a second thought until, okay, now no more cancer, but my goodness, this is incredibly difficult and nobody seems to get it.
Yeah.
And it causes distress. People can feel isolated. People can feel ashamed. of even having the complaint. Like, what do you know? How can I complain when I'm not dead, when I'm living my life? And at the same time, it keeps people separate. It's like, it's how do I explain to people that I can't eat the way I normally used to? Eating is such a communal act of fellowship and connection, or even things like engaging in conversations and having to stop and dealing with xerostomia, with dry mouth. All of these are incredibly bothersome, even distressing. So in terms of the big picture, this is why we're talking about it, because it lives in a family of symptoms that have a significant impact, but are not thought of as big, major symptoms. I'm not saying they're not. I'm saying they're not thought of. Like, oh, what's the big deal? Dry mouth, have some water.
Yeah. No, I completely agree with that.
Which is completely inaccurate. So that's kind of where we're starting. And that's why we're having this conversation. How do we talk about that? How do we engage around that? How do we think about it in a way that doesn't make it into something grandiose that it's not, but puts it in its proper place as something to talk about, as something to address, and as something to not pretend isn't happening.
Mm-hmm. Yeah. Well, you mentioned the connection between distress and so-called minor symptoms.
Yeah.
So explain that to me a little bit.
Great. So let's talk about this word distress. It's a kind of a catch-all bucket term that can mean anything from being upset to being angry, to being resigned, to being scared, to being anxious, to being frustrated. So all of that falls into that big bucket of distress. Mm-hmm. It's some response to things shouldn't be this way.
Yeah.
Like the biggest possible sense of the word, that's what it is. And people respond to it shouldn't be this way by being upset, angry, sad, withdrawn, anxious, defensive, all the things. And sometimes people are upset about the symptom. Sometimes people are upset because of what the symptom means to them. Mm. And sometimes they're upset because it's one more gosh darn thing. And it is the final straw. It is not like I got through cancer, I got through treatment, I got through surgery, I got through radiation, but my goodness, now I have to deal with this. So sometimes it's that. So if it's all right with you, I think it's worth unpacking that a little bit.
Yeah, absolutely.
Great. So what really causes distress? The biggest context is this. For me, it's like the most human, or it's one of like these emblematic things of being human. It shouldn't be this way. It shouldn't have gone this way. All of us think that. And then when you step back for a moment, you go, wait a minute, how do I know how it was supposed to go? But we do live like we know how it's supposed to go. And then when it doesn't go the way we expect it to, whatever it is, in this case, your physical well-being, it's upsetting. Well, now, the other aspects of it, I'll say like this. It's in terms of what causes things to be distressing. Well, one of the things is the functional aspects. Like, it literally is frustrating because you can't function in the way that you used to. You can't chew, you can't taste, you can't digest, you can't speak, you can't connect with people when they're doing those activities. It actually impacts function. And the more you're functionally impacted, the more distressing it is. So for example, someone who made a career as a public speaker but now has xerostomia, that's a massive impact. Mm-hmm. Someone who spends most of their day silent doing computer programming, for example, or coding or other work of that nature, as an example, it'll have less of a functional impact. I'm not saying it has none, but it doesn't impact, for example, like one's livelihood in the same way. Hmm. And all of this, right, is under the rubric of it's a minor symptom. So that's one aspect, the question of function. The other is the question of the psychological impact of it, which may or may not be related to the function. Some people may be upset because it's upsetting, because some folks, I'll speak for myself as one of them, like to have control over stuff. And if I'm not in control, even though I cognitively am aware that I'm basically not in control of anything in life, but I like to have control. And if I don't have control, I get upset. And this is one thing that, my goodness, like there's nothing I could do about it, and it's really upsetting. Or the significance of it, like someone may put this symptom in a bucket called, now I am not the way I used to be. Now I'm never going to be the way I used to be. Like now I'm broken, deficient, less than, etc. And if it lives in that bucket, that's going to cause significant distress. You were going to say something.
No, I'm thinking about how it impacts I think about relationships, and I've always talked about relationships are the oxygen of human development. A very wise woman said that. And it's true. And I think about eating food, and I think about Jason, and I even think about our mom. Two completely different scenarios is that our mom has Parkinson's versus Jason is a head and neck cancer survivor. And both of them have challenges with oral health. And both of them, especially Jason, it was harder for him to want to go out to have dinner with friends. He typically at this point has adjusted that to, well, let's go out and have a drink. And he doesn't drink because he doesn't drink. So he's drinking water, and that's how he's trying to maintain socially, because it's normal. It's normal to take drinks of water. But when he's eating, it's so hard for him to swallow. And I believe that there is anxiety about what happens if my food gets stuck in my throat. And so it's better to not be in front of people. So he does shy away. Our mom is the same way, Jay.
Yeah, mom is completely different, Dr. Mittal, and that's interesting. It actually is a form of her dental health actually causes some isolation. It almost makes her stay alone. She doesn't want to eat in front of people because she has such issues with excess saliva, which is caused by her dry mouth. And so she doesn't want to be in front of people. She doesn't want to talk. And when you said public speaker, she actually was a public speaker. And so even as her disease has progressed over 20 years, it has changed her life. And she's mad about it, and so I think more than anything, she's mad at dental health, and Parkinson's. But that's really interesting because both of them have the issue, but their reactions are very, very different.
That's really interesting. The way we engage with each other is mostly up here, whatever that is. Even right now, the reason Zoom works is because you don't need to see my calves in order for us to have this conversation.
That's true.
And eating is one of them. Eating is something that brings human beings together. There's a reason we have the expression breaking bread.
Yeah.
It is something that and if you can't participate in that,
it
is both frustrating, separating, shameful, but also, like I said, it really does depend on what's the context that it's being held in, because someone else might say, I want to be with people, I just might not eat with you, and that's okay with me. And another person might say, if I can't eat with you, I will be separate, different. People will look at me, judge me. I don't like that. That's too stressful, shameful for me. So I won't participate.
It's all a point of view.
It really is the question of, how do I hold this for myself?
Yeah.
And then it is the question of, how do I make sense of and live with this new experience? This, the term that's used is this new normal.
Yeah.
Which is the term in the literature. It's kind of a strange term because normal is always changing, but it really refers to the new physical, psychological, financial, interpersonal reality after someone goes through a major medical illness. Usually it's referring to cancer, but others as well. And how do I now live that way? And it really is the question of, how do I make that choice? There are lots of things that are involved with it. How do I let go of, grieve the person that, or at least I'll say, I think it's the functional capacity that I used to have, and now engage fully given whatever functional capacity I currently have. The alternative is to constantly be mourning some loss while missing out on life, which is, I'm not saying that's easy by any stretch of the imagination.
Right.
That's very difficult, but that is the challenge, that is the task.
Yeah.
Well, and I think grief is the right word because there is loss, and
Yes.
not just loss of saliva. There
No.
is loss of many things. And so how do I find those? How do I fill in the gap for the loss? How do I, one, recognize it and own that I'm experiencing that, and maybe identify? Because I think some of the hardest time is it's hard to identify that I'm having grief. I can't
Yeah.
figure out what's wrong with me, and I have these feelings, but I don't know what to attribute it to. And then it's like, oh, is it loss?
Yeah. Well, that's already one step ahead of the game, what you just said, which is, oh, I'm having feelings and I don't know what to attribute them to. For
Mhm.
many people, I'm just ticked off, or I'm just going to isolate.
Yeah.
And the first thing to recognize, I think, is exactly what you're saying, is that these feelings are a normal part of the experience for many people. And one of the critical elements of that is to not trivialize the symptom.
Yeah, absolutely.
Because it is not, there is no, someone once said to me that the only minor surgery is the one you're not having.
Exactly.
But it's true that when people say minor symptoms, I don't know what that means. The question is, how does it impact the living of your life and your satisfaction in the living of your life? That will determine if it's minor or not. Some people have limb loss and they're just like, that's fine, no big deal. And for some people, it's devastating. It really is. Again, I keep coming back to, there's no such thing as minor or major symptom. It is how it lives for you. And so if you can say, okay, I'm dealing with this, it's really impactful. I kind of feel silly or ashamed about it, or don't know how to talk about it with people, but it really is impacting me. That's already 3 steps ahead, because now you can start to actually deal with the thing itself and not simply be banging up against life.
Yeah.
So if I'm feeling despair or distress, kind of going back to talking about that
Yeah.
distress kind of feel about my new normal. So I am now experiencing this symptom. It is not going away. So I'm
Yeah.
having to live with this side effect
Yeah.
every day. Because I know Dr. Villa talked about there are clinical trials to try to, I guess, restore salivary glands, and there's some promising things. So we have our fingers crossed for that, but there's no cure for it yet. There's just treatments to manage it. If I'm feeling despair, does that mean I'm depressed?
The short answer is no. That's
Okay.
the next question. No, I'm kidding. So the trouble with that word depressed is it means different things in different settings. So in everyday language, depressed just means sad or down. Now that may be the case. You may be feeling sad or down, but if we're talking about in a clinical context, like a syndrome, then I don't know. Major depression is a multi-organ system syndrome that affects people in profound ways across multiple aspects of life. The simplest way, I'll give you the back of the envelope question, is if you're able to kind of function normally and enjoy aspects of life that you normally enjoy, odds are it's not major depression.
Right.
But if you have any doubt, reach out, talk to your friendly neighborhood mental health professional, just ask.
Yeah. So I guess for me, and this is really important for any of our caregivers that are on here, is that what I can do if I'm suffering from this, or what I can do to help my mom or help Jason to improve that mood or overall psychological well-being. Like,
yeah.
I'm suffering from this.
Yeah.
What can I do to help? Because that's the whole goal of this, is what can we do to make a change, Dr. Mittal?
Yeah. So the first thing is to ask about it. Just to ask, rather than pretend it's not happening or B, dismissing it. So really inquiring about, yes, you have xerostomia. What's it like? What's the impact? Really just ask it.
Yeah.
The second is, and here's the hard one, okay? Not expecting it to change. So if someone's upset about something, I mean, you can talk about anything, you know, imagine you're talking with a friend or a spouse or a partner and they're upset and you just start to say, hey, don't be so upset. It'll be okay. That's not likely to be a useful strategy to help anybody.
Mm-hmm.
Rather than, it's really important to simply validate people's experience. And then you got kind of be with them where they are and get curious together, because frankly, we're here to help. And they have to be at a space where they're open to hearing something. So if someone is in the depths of their upset, their distress, you know, I know for myself, when I'm angry or sad about something and someone tries to give me some advice to fix it, at best, I will ignore it. At worst, I'll just be upset more with them. So it really is just asking about it, validating the experience, and then you can start to think about, is this something that there's a practical solution to? Is there some way to improve functionality here, if that's what the upset is about? Is there some way to explain to people or demonstrate to people ways that they can, or strategies that they can have for engaging with life with this symptom? And the last thing I'll say, we can talk about this for quite a bit of time, I should say two things. One is, unless you really, really think otherwise, don't pretend like it's going to get better when it's not.
Mm-hmm.
Like that's one of the things caregivers often do, and they collapse. I'll be kind of pointed about. They collapse, kind of softening the truth with worry about taking away people's hopefulness, which is often the opposite. If something's not going to get better, then you just got to deal with it. You know, it's kind of pretending your tire's not flat. Tire's flat. You got to deal with it. You're not going to hope. It's not going to just magically get better if it's not. So if this symptom is going to remain a symptom, then okay, this is life. And it's distressing and upsetting. Now together, let's think about strategies to help you. And the last thing, if someone really is having a hard time, then thinking about making a referral or at least suggesting a mental health care consultation. Because sometimes people really do need some professional support in getting through these times.
Do you think, because I think you're special, so take that as it is, but do you think that all psychologists, psychiatrists see that though, as that medical issue is also a mental issue? I mean, don't you have to find the right doctor? Don't you have to seek that person out that they'll say, hey, this is what's causing it?
So I appreciate it. I think you're special too. It's probably somewhere in between, like there's a needle in the haystack and everybody can do it. But I think you need to ask the questions about, do you have any experience working with people who have medical illness?
Yeah.
I think it's as simple as that. And if someone says, no, and I'm willing to learn, that's very different than no. Because as we all know, access to mental health care is challenging anywhere in the world. So if you have someone who's willing to kind of be shoulder to shoulder with you, that's already a step in the right direction. If you can find someone who has experience working with medical illnesses and the psychological aspects, even better. If you have someone who's used to working with oncology patients, that's like probably the best. But again, this is one of these situations where that person or that specialization may not be available locally. So it's the old saying, don't have perfect be the enemy of good enough.
True.
So I see a couple of comments that are going, guys, keep putting your comments and your questions in there. Janice Wendoff, I see that there's a question in here that says, does this also apply to Sjögren's patients? I'm not sure what you're referencing. If you'll just put this back, if you want to add, qualify that just a little bit more for me. So while you're putting that in, and anyone else who's got questions, because we're going to definitely be taking questions, I've got the last one on my list here for you, which won't be my last. But many people in my life, even those I'm very close to, don't seem to understand. And I'm going to tell you, like, Jason experiences that. I always refer to my husband just because he lives with it every
Yep.
day. It is in his face every day, a constant reminder of that he had cancer. And as much as he tries to forget it, the dryness in his mouth is a constant reminder. So how can I help other people? Would you advise them to help other people to get it?
Great question. How much time do we have?
We got some time. We're going to go over.
Okay. I've got a couple of thoughts about that. Okay.
Sure.
So here's the thing. Imagine if the world is covered in glass. You can either walk out barefoot and complain about how your feet are bloody, or you can put on a pair of shoes. And it's not like the softest thing to say, and I say it deliberately because people's job isn't to get it. We walk around like it's other people ought to get it and they don't.
Mhm.
Cancer scares people to their core. It's terrifying. And at best, they don't know what to say or how to be around folks with cancer. And then when people have illness, or we're the caregiver of someone who has an illness, we walk around and expect people to know what to say to us. And then we're upset when they almost universally don't. So it's kind of a setup for upset, failure on everybody's part. So the first thing I invite people to say is, they're not going to get it unless they've gone through what you're going through. How could they? Like even close family members or friends. Forget about work colleagues. They do not know how to talk about it. Certainly in the United States, work is like this place where we often pretend like nothing else happens outside of it. So it's...
Well, they do say leave your personal in the car, your belongings,
right.
and
That's
all
right.
of your emotions, thoughts, and feelings.
So that having been said, here's what I sometimes suggest. There are people around whom it's okay to pretend like nothing's happened because it's just too darn effortful to explain it all. And they're not really interested. On the extreme end is somebody who's sitting next to you on a bus somewhere. Nothing's happened. That's okay. You have to figure out where you want to draw the line and share what your experience has been. And at the same time, how you want people to relate to you. And it seems weird, but the other way is simply ineffective.
Mm.
You could say anything from like, here, I'm dealing with the symptom. I've got it handled. From time to time, it'll look like this. And, if you have any questions, feel free to ask. Just don't be weird around it. Or whatever you might say. Or you might say, I'm dealing with this symptom and here's how it impacts me. I expect you to do nothing about it, but I don't want to pretend like it's not happening.
Yeah.
Because otherwise it's kind of like I've got like an ink stain on my face and everybody's pretending that somebody's pen didn't squirt at me. I'm like, oh, don't worry about it. So the more you can just simply have it be a thing that's actually happening, and you can tell people how to engage with you about it or not.
Yeah.
Everybody can just be more present, engaged, and the shame can kind of decrease a little bit.
Yeah. I like that. I like just kind of saying that out loud. Like, I'm going to make the uncomfortable. I'm going to go ahead and get it out of the way.
Exactly.
I'm just going to get out of the way. We're going to name it, and then we're just going to move on.
It's funny. It's like, I'm not going to say it's too kind of silly, but it's all right. I'm gonna leave it right where you put it. That's great.
So I have a question. We've got a question over here. How can one help a person who has given up on oral hygiene and health due to dry mouth? How can that person be motivated to not multiply the bad?
It's a great question. The first thing I just want to say is appreciate your stand for this person, because the other aspect of it is good on you for not giving up on them who has given up.
Yeah.
So again, consider that people take action when they see that it can make a difference. And if I don't see how my action can make a difference, I'm not going to take an action at some point. I mean, I might try it a few times, but if nothing makes a difference, I'm going to give up. So the question, I have two questions. I obviously don't know the situation specifics, but one is, because I'm a psychiatrist, I do wonder about actual major depression. Some people are dealing with, when people have actually given up on things, I worry that kind of helpless, hopeless position is indicative of depression. So there may be something else happening that requires treatment. The second is, you take it one step at a time. It's like, what's one thing they can do? But they kind of have to want to do a little bit. See, if you come at them with it, you've got to do it, don't give up, they'll just retreat further. If you come at it like, I know this is really hard, looks impossible, and can we just hang out with it and see maybe there's something that might help?
I would agree with that. Yeah, I think, people want to take control back when there is no control. So telling people what they should do, that is a component of, I'll show you what I can do.
Oh, I'll show you what I won't do. Yeah,
I'll
exactly.
show you what I won't do because I have control over that.
That's right. I mean, the silly example is telling an upset teenager to clean up their room.
Yeah.
They're like not going to do it very well.
No.
I'll show you.
I'll show you. Messy.
Yeah.
I gotcha.
Well, and I know we're right at the end of our time, guys. If you have additional questions, I can't believe the 30 minutes already gone past. I mean, just love this, Dr. Mattel. And so Janice was mentioning, I missed the second part, talking about how probably the reluctance around going out to eat and doing normal daily activities applies to Sjogren's patients as well.
For Sjogren's, absolutely.
Yeah,
absolutely. It's the same. How you get there is almost, not really. How you get there almost doesn't matter in this scenario. The fact that people are dealing with this symptom is that they're dealing with the symptom.
Yeah. Well, and I can tell you as a caregiver, I try to be very patient with Jason as far as like when we're eating dinner. I have had to slow down how quickly I eat so that it doesn't make him feel uncomfortable, because I'm a fast eater. When I'm hungry, I'm like num, 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 num. And he ate slow before. He eats exceptionally slow now. And so I really, as a way to try to be non-verbally supportive, I slow my actions down to mimic his. And so as I think about, I want one more question for you. For all of the dental professionals, the RNs, the social workers, speech and language, do you have any recommendations for them as they're working either with caregivers or the individuals themselves, advice that you might say, and maybe even caregivers or loved ones who are supporting these individuals? Words of advice for them?
Big question. I mean, I think the one thing is to ask about it, to really ask about it and ask what's the impact of the symptom on their lives. The simple act of which already has people feel cared for. Simple act of asking.
Yeah. Well, Dr. Mattel, thank you.
My pleasure. Thank you for the honor of being here.
Always.